Hi, I'm Paul Brown and I'm a member of the SSG Training and Consultancy team. I'm here today to talk to you about respiratory diseases. Respiratory cancers, including lung cancer, can be caused by exposure to a number of hazards in the workplace. These include crystalline silica, asbestos, mineral oils and diesel engine fumes. Chronic obstructive pulmonary disease is a serious long-term lung disease resulting in inflammation of air passages, damage to lung tissue, chronic bronchitis and emphysema. The most significant cause of COPD is smoking. However, exposure to a number of workplace hazards, dust, gases, fumes and vapours can make this problem significantly worse. Pneumoconiosis is a long-term, irreversible lung disease characterised by scarring and inflammation in the lung tissue. Common types of this are silicosis and asbestosis. With this kind of lung condition, there are long latency periods. Symptoms don't always become apparent until later in life. Occupational asthma can also be a problem when exposed to certain hazards. This is asthma which is caused specifically by exposure to things in the workplace. There's currently around 12,000 deaths a year in the UK due to occupational respiratory diseases. Around 4,000 of these are due to COPD. Around 174,000 people currently have breathing or lung problems thought to be work-related. There are an estimated 10,000 new cases of breathing or lung problems each year. A significant number of these are related to respirable crystalline silica. Nearly 500,000 working days are lost annually due to work-related breathing or lung problems. Respiratory diseases are serious illnesses that often result in early death. It's the single biggest problem facing us in the workplace today. Seek help and advice to stop smoking. Remember that smoking significantly increases the risk from exposure to respiratory hazards in the workplace. Where you can, plan tasks to eliminate exposure to dust and fumes. Where it's not practical to eliminate the dust, exposure to it needs to be controlled. Wherever you can, use tools with extraction systems to get rid of the dust. Employ wet cutting techniques where appropriate to reduce the amount of dust generated. Cost assessments should be carried out for all hazardous dusts, fumes, vapours, etc. The findings of these cost assessments need to be communicated to everyone who may be affected. Apply all control measures that are identified in the risk assessment and cost assessment. Wear any PPE that's provided to protect you from hazardous substances. Any respiratory protective equipment that's provided will need to be fitted to you individually to ensure that it works. Make sure that you report any damage or defects in PPE or any other control measures immediately. Always remember that if other workers are in the area, they will need protecting as well as you.